Welcome, and thank you for your interest in the Compass Rose Health Plan. Today we will cover who Compass Rose is, an overview of our plan offerings, our benefits, a brief discussion on Medicare, and our health and wellness programs. Compass Rose started in 1948. We are a not-for-profit association that proudly serves federal employees and retirees. For 76 years, we were only open to certain agencies. But starting in 2025, we were excited to open to all federal employees and retirees under the FEHB program. Today, we're going to walk through our three plan options. We have our standard option, our high option, and then included with our high option, you're able to enroll in our Medicare Advantage offering. All of our plan options include free preventive care when using an in-network provider, worldwide coverage, no matter if you're traveling for work or fun, no referrals required to see a specialist, and a nationwide network powered by the United Healthcare Choice Plus network. Our standard option is our lowest premium option. It has in-network only coverage, except in emergencies. Again, we offer a very large network across the country through United Healthcare Choice Plus, so you should be able to find an in-network provider where you are located. Members in our standard option have lower copays when using premium care physicians. These are providers who have met certain benchmarks for providing quality and cost-effective care. Under our standard option, members get 5 free virtual visits a year when using Doctor on Demand, and they get a $100 annual vision allowance to use on eye visits, glasses, contacts. Under our high option, members have a larger premium but have lower costs during the year. So this plan has low copays, in and out of network coverage, premium pharmacy benefits, and members can earn up to $350 in wellness rewards. Under the high option, members have unlimited free virtual visits per year when using Doctor on Demand or their in-network primary care provider. This slide shows our biweekly premiums for 2026. Under the standard option, self-only members pay $61.64. For Self Plus One, the biweekly premium is $135.61. And for Self and Family, the biweekly premium is $147.94. Under the high option, the biweekly self-only premium is $140.06. For Self Plus One, $311.44. And for Self and Family, $337.57. This slide shows the annual deductible and annual out-of-pocket maximum for in-network care for both of our plan options. So the deductible is the amount you pay out of pocket for certain services before insurance kicks in and starts paying. Many services, however, covered by Compass Rose are covered prior to the deductible being met. For the standard option, the self-only annual deductible is $500. And the Self Plus One and Self and Family deductible is $1,000. On our high option, the self-only deductible is $350, and the Self Plus One and Self and Family deductible under the high option is $700. The out-of-pocket maximum is your catastrophic protection during the year. We pay 100% of the plan allowance after your expenses total these amounts. Under the standard option, the annual out-of-pocket maximum for self-only coverage is $9,000. For Self Plus One and Self and Family, this out-of-pocket maximum is $18,000 per year. For the high option, the annual out-of-pocket maximum is $6,000 for self-only coverage. And then for Self Plus One and Self and Family, this amount is $12,000. Now let's cover some of our medical benefits. Under the standard option and high option, all preventive care is covered at 100% when using an in-network provider, so you have no out-of-pocket cost. For primary care, under the standard option, when using a premium care physician, your copay is $10, and when using a non-premium care physician, your copay is $35. Under the high option, the copay for primary care is $15. Under the standard option for specialist, when using a premium care physician, your copay is $30, and when using a non-premium care physician, your copay is $70. Again, premium care physicians are providers who have met certain benchmarks around quality and cost-effective care. To locate one of these providers, you can go to compassrosebenefits.com/UHC and look for the provider with the two blue hearts next to their name. Under the high option, a copay for specialist visit is $25. As mentioned previously, under our standard option, virtual visits through Doctor on Demand are covered at 100% for the first 5 visits. After the 5th visit, your copay for these visits would be $10. Under our high option, your copay for Doctor on Demand visits is $0, unlimited during the year. For mental health coverage, the standard option office visit copay is $10, and for high option, it is $15. For routine maternity coverage, under the standard option, you would pay 30% of the plan allowance after your deductible has been met. Under the high option, you have no out-of-pocket cost associated with routine maternity care. We cover 100% of them. For urgent care, under the standard option, our copay is $50, and under the high option, the copay is $35. This amount is waived if you're admitted to the hospital. For emergency room coverage under the standard option, you're responsible for 30% of the plan allowance after your deductible has been met. For the high option, you're responsible for 10% of the plan allowance after your deductible has been met. Again, these are also waived if you're admitted to the hospital. For lab work under the standard option, you pay 30% of the plan allowance after your deductible has been met. For the high option, if you get your lab work at LabCorp or Quest, or if you have your provider send your labs out to LabCorp and Quest, you have no out-of-pocket costs. We cover 100% of those charges. Both of our plan options also include coverage for massage therapy. Under the standard option, you're reimbursed up to $75 per visit for up to 4 visits a year. Under our high option, you're reimbursed up to $75 per visit for up to 12 visits a year. Now to cover some of our pharmacy benefits. We use Optum Rx as our pharmacy benefits manager. This allows you to fill prescriptions at thousands of pharmacies nationwide. You can skip the trip to the pharmacy with Optum Home Delivery, and you can receive a 3-month supply of your medication for the price of 2 months. These are the amounts you will pay for a 30-day supply when using a network retail pharmacy. Under our standard and high option, your copay for generic drugs is $5. Under the standard option for preferred brand name drugs or drugs on the formulary, you pay 40% up to a maximum of $400. Under the high option for formulary or preferred brand name drugs, your copay is $50 for that 30-day supply. Under the standard option for non-formulary or non-preferred brand name drugs, so drugs that are not on our formulary, you are responsible for 100% of the cost. Under the high option for those drugs not on our formulary, you pay $75 or 40%, whichever is greater. You're also able to get a 90-day supply of maintenance medications at a 90-day network retail pharmacy, which includes CVS or Walgreens, or when using Optum home delivery. Under the standard and high option, your generic copay is $10. So when using this option, you save a copay every 90 days. For formulary or preferred brand name drugs, you pay 40% up to a maximum of $800 under the standard option, and your copay under the high option for those drugs is $100. Under the standard option for non-formulary or non-preferred brand name drugs, so drugs not on our formulary, you're responsible for 100% of those costs. And then under the high option for those drugs not on the formulary, you pay $150 or 40%, whichever is greater. This slide covers your costs for specialty medications. Specialty medications are used to treat conditions such as cancer, multiple sclerosis, and rheumatoid arthritis. They typically require ongoing clinical oversight and have unique storage or shipping requirements. These medications have to go through Optum Specialty Pharmacy for coverage. Under the standard option, generic specialty medications, you pay 50% up to a maximum of $500. On the high option for generic specialty medications, you pay 10% up to a maximum of $100. Under the standard option for formulary or preferred brand name specialty drugs, you pay 50% up to a maximum of $1,500. Under the high option, you pay 25% up to a maximum of $300. For non-formulary or non-preferred brand name drugs, so specialty drugs not on the formulary, under the standard option, you're responsible for 100% of the cost. For the high option for those drugs not on the formulary, the specialty drugs, you pay 35% up to a maximum of $500. Now let's cover some of our health and wellness programs. So under all of our plan options, members have access to Aging Well. This is a free program started to help members achieve what's most important as they age. It provides them resources on items like aging in their home, caregiving support, and advanced care planning. Under our standard and high option, members have access to Active and Fit Direct Fitness program, where they can get gym memberships at a discounted rate. Under our high option, members have access to Real Appeal, which is a weight loss program. Also under our high option, members have access to a digital exercise therapy and pelvic health program that they can do from the comfort of their home. Under both our standard and high options, members have access to Living Well, which is a free program that provides personalized support to dedicated health plan providers. And then lastly, under both our standard and high option, members have access to maternity program, which helps support them through pregnancy and after. Now let's talk about Compass Rose and Medicare. Under our standard option, when someone has Medicare primary, we do not waive deductibles, coinsurance, or copayments for members enrolled in Medicare. Under the high option, if someone does have Medicare Parts A and B primary, we waive the medical deductibles, copay, and coinsurance for those members. As I had mentioned previously, under our high option, members have access to Medicare Advantage. This combines our high option FEHB benefits and Medicare's Part A and B into one plan, which does also waive medical deductibles, copays, and coinsurance. Under Compass Rose Medicare Advantage, you get $125 a month towards your Medicare Part B premium. You have no copays for covered medical services. This plan does include prescription drug coverage, as well as vision, dental, and hearing benefits. Some exclusives to Medicare Advantage include a $40 quarterly credit that can be spent on over-the-counter items such as toothpaste, pain relief, vitamins, cough drops, and more. Also, under Medicare Advantage, members have access to Renew Active Fitness Program, which is the gold standard in Medicare fitness programs. This is available at no additional cost and provides access to a nationwide network of fitness centers, on demand workout videos, and live streamed fitness classes. Members under Medicare Advantage have access to United Healthcare Hearing. This provides them with a hearing exam, a $1,500 allowance for unlimited hearing aids every 3 years. The allowance is combined for both ears. And under United Healthcare Hearing, members have access to one of the widest selections of prescription and non-prescription hearing aids with the significant savings. Under United Healthcare Healthy at Home, members have support after inpatient hospital and skilled nursing facility stays. This is available at no additional cost and provides home delivered meals, transportation to medical appointments, and in home personal care to assist with daily activities. Under United Healthcare House Calls, members can get yearly preventive care check ins from the comfort of their home. Again, thank you for your interest in the Compass Rose Health Plan. If you have questions, please feel free to call us. For the standard and high options, you can give us a call at 888-438-9135. And for questions related to Medicare Advantage, you can call us at 1-844-279-9286. You can also find additional information at compassrosebenefits.com.